Hi everybody, it's David Porter, and this morning I want to talk about SSRIs, Selective Serotonin Re-Uptake Inhibitors. These are medications which are highly effective and very safe and have received a lot of bad press, a lot of negative attention in the media that does not have a lot of scientific basis. Selective serotonin reuptake inhibitors have been around since 1991. The first one that was FDA approved was Prozac, also known as fluoxetine. And since then, a number of others have been developed, including Zoloft, Lexapro, and Paxil. Those are probably the most commonly prescribed ones. They were originally developed for management of major depression, and it was also found that they work very well for management of various anxiety disorders, including general anxiety disorder, anxiety associated with PTSD, obsessive compulsive disorder, and specific phobias. So they have a wide range of uses. They're very safe and they're very effective. Now, why so much bad press? Because, one more time, the media is not there to inform you or educate you. The media is there to make you scared and outraged. The media will choose the right words and the right tone of voice and the right information and feed it directly to your amygdala. That is the part of the brain which is the fear-anger center, the part of the brain that scans all incoming sensory information and very quickly, within microseconds, determines whether or not it's a threat and if we need to go into the fight, flight, freeze mode in response. The media reaches into your amygdala and presents very skewed and biased and carefully selected information designed to make you angry and outraged or fearful, because fear sells, outrage sells. And remember, the media is a for-profit entity. They want your attention. That is how they earn a profit. Keep that in mind anytime you have any media exposure. And for the record, no, I am not a prescriber. I am a behavioral healthcare provider, that is a psychotherapist, and I cannot prescribe meds. I must refer patients who I think need a medication consult to either a psychiatrist, which are in short supply in Vermont and throughout most of New England, and or I have to refer them to their PCP, their primary care physician, and the PCP and I discuss what's going on with the patient, and the physician makes the final determination whether or not they're going to prescribe, and if so, what they will prescribe. So I have watched people make very dramatic turnarounds taking SSRIs. They are freed from anxiety, from depression, from all of the things that go along with anxiety, depression, such as insomnia and the inability or difficulty to leave the house, difficulty functioning, and I've seen it greatly improve people's quality of life or even save people's lives. People who were suicidal and self-destructive. Now, no medication is completely 100% safe. All medication has the desired main effects, and then they have the side effects, which can be undesirable. And also, when you start taking multiple medications, you are also going to run into the problem of medication interactions. The prescribing physician is always going to have to weigh the potential benefit of taking the med with the potential risks and consequences. And there's going to be a treatment team deciding this. If it's a primary care doctor who may or may not be knowledgeable about psychiatry and psychopharmacology, I'm going to consult with them, give them the best information I have. The physician makes the final decision. They may consult with peers, and then the last line before you get the medication is the pharmacist. Everybody, find a good pharmacist. Pharmacists are very knowledgeable about meds. They love talking about meds. And the pharmacists I know have very generously given me sometimes up to half an hour of their time, even when they're very busy, to talk to me and educate and inform me. And most pharmacies have a database where they will run your prescriptions, and you can also tell them to include over-the-counter medications, just for a triple check that there will not be any med interactions. So don't overlook pharmacists as a great resource. Typical side effects of SSRIs, and what to expect if you're going to take an SSRI. The first thing to expect when you're taking SSRI is nothing. Probably for a week, two or even 3, you're not going to feel anything. You will not get any beneficial effects from taking an SSRI for probably 4 to 6 weeks. Now, what you will notice after a few doses, after a few days on it, is your dreams are going to get strange. Not bad, but long and very vivid. You're going to stay in REM sleep. You're going to go downstairs to REM sleep and stay there longer than normal. And your dreams are going to be epic. That is, they're going to be very long, and they're also going to be very vivid. All of your senses will be engaged in the dream. It will feel very much like real life. And most people say this is a pleasant side effect. The not so pleasant side effect, and this doesn't always happen, but in men, it can produce ejaculatory delay or failure. And here's an interesting bit of trivia. Male porn stars will take Zoloft and the other SSRIs off-label in order to prolong sexual endurance. It's also prescribed for men with early ejaculation because it will prolong endurance for up to 20-30 minutes, maybe even longer. Basically, your physical endurance will probably give out before your sexual endurance. The other side effect is you're probably going to feel tired, and you may need to take a nap around 5-6 p.m. You feel like you need a nap, then that's okay. You feel tired, lay down and take a nap. That should go away after a week or 2. That side effect should not persist. You might get a headache, you might get a little queasy, not actual nausea and vomiting. Very few people get that. That hardly ever happens. A lot of people report their stomach feels a little queasy, but that goes away. Again, the queasiness and the fatigue tend to resolve pretty quickly. The sexual side effects do persist. If that becomes a problem, you talk to your prescriber. Sometimes the scheduling of the dose, taking it in morning instead of evening, or reducing the dose. This is why I don't prescribe. This is why I have to leave that up to the physicians. Okay, anyhow, back to SSRI side effects. You're going to notice a couple other things, and other people may notice it before you do. People might say you look younger because your face is going to smooth out. When people are anxious, depressed, their facial muscles will tighten up involuntarily, and their face looks kind of scrunched up. And it is one of the more subtle effects of depression and anxiety. You take away the anxiety or depression, or at least dial it back, your face kind of smooths out. All the muscles relax. The other thing you may notice in the morning when you first wake up, you might stretch. When you first wake up, you might have a good stretch like a cat. And again, that indicates a reduced degree of tension. So these are some of the things you can expect when you take an SSRI. So if you are currently struggling with depression or anxiety, and also very often anger accompanies depression and anxiety, talk to your prescriber, talk to your primary care physician about whether or not you should be on an SSRI. Look up the 4 big ones: Zoloft, Lexapro, and Prozac, and Paxil. Look up the big 4, and there's another one too, Celexa, also known as citalopram, and look up the chemical cousin, which is Wellbutrin, and educate yourself. Get some information before you do anything. Talk to a pharmacist. There are forums available where you can talk to people who have taken these meds. Just remember, the information is going to be skewed, because what you're going to get on forums, there's going to be a tendency to go out to the outer edges of the curve, and you're going to talk to people who are either very pleased with the results or had a bad response and are very displeased. There's such a thing as adverse effects. There's such a thing as a bad response. Remember, if you have a 99.999% safety and efficacy of a medication, and you write 10 million scripts, you're going to have a few hundred or thousand adverse results. When you have numbers that big, anything can happen when you have a sample size that big. So, what else can we say about SSRIs? Just that if you have depression, you probably have some degree of anxiety. If you have anxiety and or depression, you probably also have some degree of excessive pathological anger. The three tend to go together. And the good news is SSRIs tend to hit all three. And something I started to say before I got sidetracked is that no, I don't get a dime for making this video from any pharmaceutical company. I do not get a dime from recommending that someone see a physician for a med consult. I do not get any financial consideration for it. And I am here to talk about science, to be as objective as possible, based on the research, based on a pretty large sample of the patients I've seen. I've been practicing for going in a little over 21 years. So I've seen a lot. I've seen what works. I've seen what doesn't work. And I try hard to keep up to date with all the research. So SSRIs are something that I found effective. And I would recommend at least considering it and talking about it. Here's some irony for you. Some of the same people I've spoke to or hesitate to take an SSRI because they saw some bullshit on YouTube about it will drink a liter of vodka a day. It's called selective perception. Because downing a liter of vodka or other distilled spirits every day, or almost every day, to try to fix your mood is going to produce a whole lot more harm, short-term and long-term, than taking one of the aforementioned meds. So, consider that. Everybody, thanks for watching. Please hit subscribe. Keep an eye on this channel for more videos, and be safe.